In the BBC Understand the Economy podcast series, which breaks down how economics affects everyday lives, the last episode was dedicated to inequality. In that episode, Tim Harford and senior research economist Xiaowei Xu talk about income and wealth inequality. But in the very beginning of the episode, a key question is raised. Why does it matter? What is the impact on the society? Inspired by that podcast, I'm joined today in this ad hoc episode of Equity Lens by Lancaster University Professor of Health Inequalities, Heather Brown, to extend that discussion and look for answers to the question, why does inequality matter? Why does income inequality matter for health? And why does health inequality matter for society? Hi, Heather, and thank you for taking time on a Friday afternoon.
Hello, Katerina.
So we're here to talk about health inequalities. And we have posted a short trailer on that. But perhaps it's best I ask you in this instance, what do we mean by that? So what does health inequality stand for?
Well, the simplest definition is health inequalities are differences in health status between people. But it is, in reality, a bit more complicated than that because it depends on how you measure health and what you mean by health. And it can also even refer to differences in healthcare. So for one thing, we could look at, say, differences in life expectancy, differences in quality and experience of care, behavioral risk factors, for example, smoking rates, obesity rates.
So following on from Tim and Xiaowei's footsteps, in their podcast, they started by reviewing the evolution of income inequalities since the middle of the 20th century. This might be a very naive question, but is it even possible to paint the equivalent picture of evolution over time for population health? I mean, given the amount of conditions there are, and as you said, all those differences in how you measure things.
Well, yes and no. So things such as life expectancy, that is been measured in a standard way since, let's say, about the 1890s. So yes, you can look at differences in life expectancy. I guess one of the caveats is that how you measure socioeconomic status has changed slightly. So kind of occupational classifications is a common way of doing it. And obviously over time from the 1890s, the jobs that people have done have changed. But we can roughly say that we can look back till about the start of the 20th century and how inequalities in life expectancy have been evolving. And what we see that up until about 2010, these inequalities were decreasing. So much of the biggest gains in life expectancy were for those that are in the lowest socioeconomic groups. But from 2010, that has changed. So life expectancy growth, well, that means people living longer, has decreased or stood still for those in the most deprived groups. And I guess it's really stood still for everyone, but that means that this gap is not decreasing anymore. And in fact, in some cases, there's been reverses in these gains in life expectancy. So that gap has then been widening again.
So income inequality has been rather stable in the last 10, 15 years, as have health inequalities. Although that is not necessarily good news, as health inequalities were decreasing before. And also the fact that life expectancy growth stopped or in some cases decreased means that now the gap in life expectancy between those in the more socioeconomically deprived groups compared to those in the more affluent groups is widening. But it sounds also like there is a rather defined period in time around 2010 when we can observe those changes happening. What happened exactly in 2010 that brought those changes about?
Again, yes and no. So a lot of the evidence points to some changes in policy around healthcare funding for health services. So up until that point, there was substantial increases in health funding from, say, the mid-1990s, which that kind of stopped in the 2010s as well. There was a change in government policy towards, I guess, a rollback of the state, you could say. So there was a general decrease in funding, which has been called austerity. So all of those factors may have contributed. Another one, which is sometimes mentioned, is that basically, it could be that we're reaching the limit of increases in life expectancy. So it could be science and technology, but all of these factors contribute to the stalls in life expectancy. I guess the other thing is you can make comparisons. So a similar trend is being seen in places like the US, but not necessarily, and actually again in many of the other countries. So that would indicate that there might be something about, we're reaching the limits of science in terms of increasing life expectancy gains. And you have things like COVID, which pushed it back for pretty much all countries.
Right. And you're mentioning other countries. How do we generally compare in that evolution of health inequalities over time with other countries?
In terms of life expectancy, it's hard to say. So kind of with the US, in many ways, the UK does better. In terms of some of the other Nordic countries, not quite as good.
Are they more equal? Do they have less health inequalities? Is that the reason behind that?
Not necessarily. So many of the Nordic countries do have substantial health inequalities, but they've made more gains in improving life expectancy for those in the lowest groups, as well as gains for the highest groups, where we haven't had those gains in the same sort of way.
So what would we need to do to have those gains? What is it we're missing?
That's a good question. As I said, there's a couple of things that we can see, which was some of it was mentioned in kind of the Tim Harford program in terms of inequalities, that what we know is that inequalities are bad for everyone, even those at the top. So if we could think of ways to reduce inequalities, then that's going to end up improving health for everyone. Because you could think of things even like people who do key essential jobs. If they're unwell and can't work, then that negatively impacts on everyone's life, including theirs.
So, we know that the more poor you are, the more likely you are to suffer from ill health. And you've mentioned words like austerity, and often the answer is we need more money, we need more services. But for the individual, is there a cutoff point of income, for example, or how they're faced with inequalities where we can say if they have this and are above that point, then they can expect to live a reasonably healthy life?
I've been thinking about this question, and the answer is no. I don't think there is a cutoff. So Richard Eastman has developed this theory called kind of the health paradox. And it was saying, that up until a certain point of income, your health improves. But then once you go past it, it kind of fizzles out. And part of that has to do with inequalities. And they don't quite know why you have this kind of paradox that, as income increases, it doesn't do it at a linear rate with health. So that's why you can't say, if you have X amount of money, you'll be all right, because there's other factors at work in terms of how society is set up, welfare state, access to services, everything that impact on your health. So you can't just say having this amount of money without thinking of the context of where you live will make a difference.
So what you're saying is that income, wealth, they can support a healthy life to an extent, but there are other societal aspects at play so that, for example, where I live can determine my health beyond what my income allows me to afford. What about the health of the individual? Can the individual health inequalities affect the economy?
Yes. So there's a growing body of research looking at kind of health and productivity. Because I guess one of the problems with the UK is that it has had the lowest growth in productivity out of definitely the G7 countries for at least the last 10 years. And one of the growing kind of arguments for explaining this is these health inequalities, in particular regional health inequalities, where health in the north of England is on average much worse than the south of England, and saying until we have kind of more equal health across the country, then productivity will continue to decrease, because if you're unhealthy, you're going to take more time off work, you're going to be less productive at work, and then that is part of what's slowing economic growth.
In February 2022, so February this year, there was a white paper that came out proposing some levelling up actions. And as the government put it, the aim was to spread the opportunity more equally across the UK. Did that refer to this northern-southern divide that you just mentioned? And does the paper apply to health and health inequalities as well?
So part of that is, yes. Health is a big part of kind of the levelling up agenda, because there's been a case made, as I said, that kind of without improvements in health, you're never going to have this levelling up. So one of the key outcomes of the levelling up paper is to decrease differences in healthy life expectancy between the North and the South. And it states that to achieve this, it will focus on other dimensions, including education, skills, employment opportunities. So the paper, I guess, acknowledges that health is important, but to achieve improvements in health, it says by focusing on these other outcomes, that health will naturally improve.
So it sounds like it's a sensible strategy to target multiple dimensions like employment and education if we are to improve population health. So while the government is planning and acting on that, is there something that the individuals can themselves do to reduce health inequalities, or is this a bigger political agenda item that can only be addressed by those in key decision-making positions?
Well, I don't necessarily know about the individual. I think more so maybe communities. So thinking about kind of creating communities that foster healthy lives. So sort of things is, I guess it relates to social capital, like having community groups, having access to green space, those type of things. So some of these things are beyond the control of the individuals. But again, none of these things will be achieved if there's not sufficient funding to support these type of programs. In an ideal world, the Levelling Up Fund would support these local initiatives.
And do you think that is likely to happen?
No. But I guess it depends on what you think about if the Levelling Up agenda is actually lip service to these things or will actually achieve anything.
So the ultimate goal would be to reduce or ideally eliminate health inequalities. But as somebody who does a lot of research in this area, what is your vision for the future of how we get there? How do we get to social justice?
So I guess, what's proposed in terms of improving educational opportunities. So I think I guess you need to think more holistically about some things. I think the key thing is to have a more focused medium to long-term objective. So think about kind of the key problems that are faced in this country. So one of them is climate change, and thinking about how then levelling up can be targeted to addressing some of these things to creating a sustainable future. So such things as investing in green jobs, infrastructure, new technologies, training people in these new technologies, opportunities for young people to engage with this agenda. And I think much of that is missing from the levelling up agenda. And if we don't kind of link up, combine these different problems that we're facing, then I don't see how we could reduce health inequalities.
Heather, thank you so much. What do you think about the levelling up agenda? Use #ImplementEquity to tell us your thoughts. This was an ad hoc episode inspired by Tim Harford and his podcast on inequality. As Katerina promised, next month we'll hear from Dr. Niv McMahon and get a chance to contemplate on the language we use around health equity and inequalities.